Well, you can get another cup of coffee this morning as we address an important women's health topic. January is Cervical Health Awareness Month, and here to give us current treatment testing recommendations is Nurse Christina Paris. Good morning to you, Christina.
Hi, good morning.
Thank you so much for joining us this morning. And, first let's start off with the basics. So what is cervical cancer, and are there any symptoms of it?
So cervical cancer, it's rare, it's usually preventable, and can often require some lab tests to determine if you have it. So when we're talking about the cervix, it is the lower part of the uterus. The uterus is kind of where the baby grows when we're pregnant, and then the cervix is the lower part. And when we talk about it being dilated, when you're about to have a baby, you'll hear, you're dilated to 3 centimeters. That's the part of the body that we're talking about when we're talking about women's health. Symptoms can occur. Any kind of abnormal vaginal bleeding, any foul odor, pelvic pain, difficulty or pain with intercourse, or any kind of abnormal bleeding either after sex or after menopause. Those you want to go and talk to your doctor about.
Okay, wow. So how exactly is cervical cancer detected?
So we can do women's health screenings for this. So men have their own issues, but this one is strictly for women. And you can go and get a pap smear. So they used to do it annually. You used to start when you were really young. I remember when I was a kid, they would, or younger, they would start women at like 16, 17 years old. Now, they don't recommend it until you're older. So you go in and they just scrape the lining of the cervix, and they can put those cells on a slide and check. And if it's normal, you're good. You don't have to have it done for 3 years. And if it's abnormal, then they might want to do it again. So again, the recommendations are over the age of 21. Between 21 and 30, you want to do it every 3 years. And between 30 and 65 years of age, every 5 years. And over 65, you're considered low risk, but you still want to go in for a pelvic exam and talk to your doctor.
All right. Well, are there any ways to just prevent or treat cervical cancer?
So it can be prevented. Again, the main kind of culprit that causes the cells in our cervix to change and grow abnormally is the HPV virus. So we do have a vaccination for that. So getting vaccinated is a great way to prevent this. Now, if you do have cervical cancer, there are a couple of different things you can do. Sometimes surgery is required. Sometimes just removing parts of it, of the cervix, but sometimes they have to do what they call a radical hysterectomy, where they remove everything. Now, if you are considering getting pregnant, you do want to talk to your doctor before having any of these surgeries. So sometimes just if you have smaller things done to remove it, you can still get pregnant. But if they do radical surgery, radiation, or chemo, that might affect that. So either way, you always want to go in and check with your doctor. Make sure you're going in for your annual women's health exams, and stay healthy.
Absolutely. Well, thank you so much, Nurse Christina, for giving us these really helpful tips. It's something that we all have to keep in mind for sure, and I hope that you have an amazing day.
Thank you. You too.